Hello. Today we're going to talk about something many of you have heard of but might not fully understand. Cataracts. It sounds complex, but my goal is to make it simple and clear for everyone. Inside our eye, right behind the colored part, the iris, we have a natural lens. You can think of it like the lens in a camera. For you to see clearly, this lens has to be perfectly transparent. Its main job is to focus light onto the retina, which is the light-sensitive layer at the very back of your eye. A cataract is simply a clouding or an opacification of this normally clear lens. When the lens becomes cloudy, it's like trying to look through a foggy or dusty window. The passage of light to the retina gets obscured and your vision becomes blurry. This condition is a very significant reason for vision impairment and is a leading cause of blindness across the world. But the good news is, it is treatable. Cataracts can be broadly classified into two main groups: those you're born with, called congenital or developmental cataracts, and those that you acquire later in life. The acquired type is far more common. The most prevalent of all is the age-related or senile cataract. It is essentially an exaggeration of the normal aging process of the lens. These can form in different parts of the lens. A nuclear cataract forms in the center. A cortical cataract forms in the lens periphery, looking a bit like the spokes on a wheel. And a posterior subcapsular cataract forms at the very back of the lens. Congenital cataracts are rare, occurring in about 3 in every 10,000 live births. They need to be managed early to allow for the normal visual development in a child. Many acquired cataracts are linked to other health issues. Diabetes is a major one. When blood sugar is high, the glucose level in the fluid inside the eye also rises. This glucose enters the lens and is converted into a substance called sorbitol, which accumulates and pulls water into the lens, causing it to swell and become cloudy. Other conditions are also linked. For instance, about 90% of patients with a genetic condition called myotonic dystrophy develop fine iridescent cortical opacities in their 30s. Around 10% of people with severe atopic dermatitis can develop cataracts in their 20s to 40s. And another genetic condition, neurofibromatosis type 2, is associated with early cataracts in more than 60% of patients. Sometimes, cataracts are a side effect of other eye problems. Chronic anterior uveitis, which is a type of inflammation inside the eye, is the most common cause of this secondary cataract. The longer and more intense the inflammation, the higher the risk. Finally, trauma is the most common cause of a cataract in just one eye, especially in young individuals. A direct injury to the eye can damage the lens and cause it to become opaque. So what is actually happening inside the lens to cause this clouding? The transparency of the lens is maintained by a very regular, precise arrangement of its fibers, which are devoid of any organelles. In a cataract, the proteins within the lens fibers start to denature and coagulate or clump together. This disrupts the regular arrangement, scattering light instead of focusing it properly. There can also be an increase in water content in the lens, a process called hydration, which further contributes to the loss of transparency.
We often talk about the maturity of a cataract. An immature cataract is one where the lens is only partially opaque. A mature cataract is when the entire lens is completely opaque and vision is significantly reduced. If left untreated, it can become hypermature, where the lens cortex can either liquefy, creating what is known as a Morganian cataract, or the whole lens can shrink and wrinkle. How does this affect a person's vision? The most common symptom is blurry or cloudy vision, but patients are also characteristically troubled by glare. This is especially noticeable at night, for instance from the headlights of oncoming cars. Symptoms can also feel worse in bright sunlight or during activities that require near vision, as this causes the pupil to constrict, forcing more light to pass through the central, often cloudiest part of the lens. Diagnosing a cataract is usually straightforward for an eye specialist. It starts with checking your visual acuity on a chart. Then, we use various instruments. An oblique illumination with a torch can often show the opacity. A distant direct ophthalmoscope will show a black shadow against the red glow from the back of the eye. But the gold standard is a slit-lamp examination. This is a special microscope that gives a highly magnified three-dimensional view of the eye, allowing us to see the cataract in detail, determine its type, and grade its hardness, which is very important for planning the surgery. Before any surgery, a thorough pre-operative assessment is absolutely essential. This is a multi-step process. First, we take a detailed general medical history to understand your overall health. Then comes a complete ophthalmic evaluation. We check your vision and your pupillary responses. It's important to note that a cataract alone can never produce an afferent pupillary defect. So if that's present, it implies there's another problem. We examine the eyelids, the cornea, the anterior chamber, and of course the lens itself. We also need to examine the fundus, the back of the eye, to rule out any other pathology like retinal problems or glaucoma that could limit the visual outcome after surgery. A critical part of this process is informed consent. It is essential that the patient has arrived at a fully informed decision to proceed with surgery, understanding all the potential benefits and risks. Finally, we perform biometry. This involves taking precise measurements of the eye's length and the curvature of the cornea. This data facilitates the calculation of the intraocular lens power that is likely to result in your desired postoperative vision. Visual improvement is by far the most common indication for cataract surgery. And it's important to understand that surgery is the only effective treatment. There are no drops, medicines, or exercises that can reverse or cure a cataract. Over the years, surgical techniques have evolved dramatically. Today, phacoemulsification is the most popular method worldwide and has now virtually replaced all other techniques in most countries. In this procedure, a very small incision, just a couple of millimeters, is made in the eye. A tiny probe is inserted, which uses high-frequency ultrasound waves to break the cloudy lens into small pieces. These pieces are then gently suctioned out. Another excellent technique, especially in certain settings, is manual small incision cataract surgery, or MSICS.
After the old cloudy lens is removed, it must be replaced. The best optical rehabilitation following removal of a cataractous lens is the implantation of an intraocular lens, or IOL. This is a small artificial lens that is permanently placed inside the eye. There are many different types of IOLs available, made from various materials and with different designs, including monofocal lenses that correct for one distance and multifocal or extended depth of focus lenses that can provide a range of vision. Post-operative care is crucial for a successful outcome. It usually involves a course of eye drops for a few weeks to prevent infection and control inflammation. You'll also have follow-up appointments to monitor the healing process. While cataract surgery is one of the safest and most successful surgeries performed, like any procedure, it has potential risks. One of the most common issues is posterior capsular opacification, which can occur months or years later. This is when the thin membrane behind the IOL becomes cloudy and it's easily treated with a simple laser procedure. More serious but much rarer complications can occur. Endophthalmitis, a severe infection inside the eye, has a reported incidence of about 0.1%. About 90% of the bacteria causing it are gram-positive. Other potential issues include cystoid macular edema, which is swelling in the retina, retinal detachment, or a posterior capsular rupture during the surgery itself, which happens in 1% of cases or less for experienced surgeons. It's important to have perspective on these risks. In about 1 in 1,000 operations, the eye might be left with little or no sight, and in about 1 in 10,000 cases, the patient could lose the eye. These numbers are very small, but they underscore why a thorough discussion and informed consent are so vital. So, to recap, a cataract is a clouding of the eye's natural lens, a common part of aging but also caused by other factors. It leads to blurry vision and glare. The diagnosis is made through a careful eye examination. The only treatment is surgery, where the cloudy lens is removed and replaced with a clear artificial intraocular lens. Modern techniques like phacoemulsification have made this procedure incredibly safe and effective, restoring clear vision for millions of people. Understanding the entire process, from what a cataract is to how it's treated, can help demystify the condition and empower you to make the best decisions for your eye health. Thank you for listening.